Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's April 2026 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is an original article entitled Cancer Incidence and Risk Factors in PLA2R Associated Membranous Nephropathy. It is authored by Dr. Ilario Russo from the Division of Nephrology and Hypertension at Mayo Clinic in Rochester, Minnesota, and the University of Bari Aldo Moro in Bari, Italy, and colleagues from Mayo Clinic in Rochester, Minnesota, and the University of Bologna in Bologna, Italy. Membranous nephropathy is one of the leading causes of adult nephrotic syndrome and may also cause progressive chronic kidney disease and end-stage kidney disease. Until recently, membranous nephropathy was considered either primary, idiopathic, in origin or secondary to such conditions as infections, autoimmune conditions, malignancies, or drugs. A major recent advance in membranous nephropathy is the recognition that a number of antigens on the podocyte are now identified that instigate specific antibody production and an autoimmune glomerulopathy. Some 14 or so antigens have been identified, and each type of membranous nephropathy so triggered is increasingly understood. Over 75% of cases of membranous nephropathy result from the M-type phospholipase A2 receptor, PLA2R antigen, and the attendant interaction between the relevant antibody and this antigen. This discovery eventually led to a new paradigm in the classification of membranous nephropathy. Since the emergence of these concepts, the study of the association of cancer with membranous nephropathy has received relatively little attention. To their credit, Russo et al. Studied 239 patients with PLA2R-associated membranous nephropathy diagnosed at Mayo Clinic between 1996 and 2021. Their findings demonstrate that the incidence of cancer in this cohort was increased by 93% compared with an age-adjusted U.S. general population. The following factors were found to be associated with an increased risk for cancer after the diagnosis of membranous nephropathy: age, tobacco exposure, and a previously diagnosed history of cancer. Cytotoxic agents such as cyclophosphamide were associated with an increase of cancer, but not significantly so. Not associated with an increased risk of cancer were other immunosuppressive therapies, PLA2R titers, and remission from membranous nephropathy. Russo et al. Make 3 telling points, among others, in their discussion. First, antigens other than PLA2R, such as NEL1 or THSD7A, are generally more commonly associated with cancer, and thus if their analysis included these antigens, the observed incidence of cancer would have been higher. Second, PLA2R is a transmembrane receptor that may possess tumor suppressive signaling properties. It is thus conceivable that an antibody to this receptor may nullify this suppressive effect and thereby predispose to cancer. Third, and especially from a patient care perspective, the increased incidence of cancer in membranous nephropathy underscores the need for cancer surveillance in patients diagnosed with membranous nephropathy. In recent years, there have been major developments in the understanding of the pathogenesis of membranous nephropathy and its treatment. The rigorous work of Russo et al. Draws attention, and importantly so, to an insufficiently studied area regarding this disease, namely the cancer connection in membranous nephropathy. Our first highlight article this month is an original article entitled External Validation of the Mayo Delirium Prediction Tool in Individuals with Cancer. It is authored by Dr. Norman Alley and colleagues from the University of Texas MD Anderson Cancer Center in Houston, Texas, and colleagues from Mayo Clinic in Rochester, Minnesota. Delirium occurs in 1/3 of hospitalized older patients, and more so in hospitalized cancer patients. The confusion assessment method is a widely used tool in assessing the risk for delirium in hospitalized patients. However, as noted by Ali et al., an internal quality improvement study at their institution revealed that the application of the 3-minute confusion assessment method tool was highly reliant on nursing resources. Ali et al. Sought a delirium screening tool that would not only perform well in cancer patients, but was one that was also more amenable to an automated algorithm. These investigators evaluated the Mayo Delirium Prediction Recalibrated tool in almost 1,000 cancer patients admitted to the University of Texas MD Anderson Cancer Center to either medical or surgical services. This tool utilizes a machine learning algorithm based on data from the electronic health record within 24 hours of admission. The data set was divided into 3 risk categories based on Mayo Delirium Prediction scores: low, intermediate, or high-risk scores, and data so stratified were used to assess performance characteristics of this tool. Overall, the Mayo Delirium Prediction tool demonstrated good capability for predicting delirium risk in this patient population, especially in surgical patients. For individuals at delirium risk, the tool had lower sensitivity but high specificity. For individuals predicted to be at a low risk, the tool had higher sensitivity and lower specificity. In their discussion, Ali et al. Point out the importance of predicting and taking steps to prevent delirium in hospitalized patients, as the latter increases morbidity and mortality, lengthens hospital stay, and may promote functional deterioration. As suggested by these investigators, the better performance of the Mayo Delirium Prediction tool in surgical patients may relate to the lower delirium occurrence in their study population, or that in planning for surgery, relevant patient factors are taken into consideration. Ali et al. Also point out that based on the intended use of the prediction tool and the desired level of sensitivity or specificity, a tailored risk score and cutoff can be accordingly incorporated. Finally, as the Mayo Delirium Prediction tool was validated in a Midwestern healthcare system and involved very few cancer patients, Ali et al. Uniquely demonstrate that the utility of this tool extends to cancer patients managed at a tertiary cancer center in southern United States. Our second highlight this month is an original study entitled Antibiotic Use and Colorectal Cancer in Olmsted County, Minnesota. It is authored by Dr. Dima Bechanati from the Department of Family Medicine at Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic and several U.S. medical centers. Colorectal cancer is one of the dominant causes of cancer-related mortality, both nationally and globally. Especially concerning is the increasing incidence of early-onset colorectal cancer. The etiology of colorectal cancer is ascribed to factors that are non-modifiable, modifiable, or those that relate to chronic diseases. In recent years, there is considerable interest regarding the disruption of the gut microbiome and the pathogenesis of colorectal cancer. Antibiotics can upset the gut microbiome through myriad ways. They can decrease the population of salutary bacteria, increase the population of pathogenic ones, especially those that promote aberrant cell growth, and incite inflammation, compromise immune responses, and breach the epithelial barrier. A substantial literature has examined the association of antibiotic usage and colorectal cancer, but the conclusions thus far are inconsistent. Using the Rochester Epidemiology Project, Bechanati et al. Undertook a retrospective case control study examining cases of colorectal cancer diagnosed between January 1, 2010 and December 31, 2020. Exposure to antibiotics was subdivided into none, low, intermediate, or high based on antibiotic prescriptions from 2005 to 2 years before the diagnosis of colorectal cancer. The findings of this study demonstrate no significant association between the risk of colorectal cancer and antibiotic usage, irrespective of the duration of antibiotic exposure, antibiotic class, or tumor location. Interestingly, in individuals younger than 65 years of age, low and intermediate exposure was associated with a reduced risk of cancer. Thus, using the recognized resources of the Rochester Epidemiology Project, the study by Bechanati et al. Finds no evidence of such an association between the risk of colorectal cancer and antibiotic usage. However, as emphasized by the authors, studies involving more diverse populations and optimally including microbiome data would be of timely interest. This editorial highlights cancer by discussing 3 papers on disparate aspects of this disease that are brought together and published in this issue of Mayo Clinic Proceedings. It is interesting to note that a highly publicized paper in February 2026 in Nature Medicine concluded that some 37% of cancers occurring globally and regionally in 2022 may have arisen from potentially modifiable risk factors. The field of cancer is so often and lamentably so one of challenges, frustrations, and poor outcomes. The finding that up to 40% of cancers may be preventable, including by alterations in lifestyle and environmental exposures, offers a ray of hope in combating this exacting disease. You can access these highlights and Editor's Choice articles free of charge during the entire month of April. We invite you to visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find access to our social media by clicking the links to follow us on YouTube, Facebook, and X under the media icons in the center of the homepage. On our YouTube channel, you'll find full-length author interviews called Highlights and our MCP 60 seconds video article synopsis. Our homepage also includes a collection of articles that honor the past and look to the future in anticipation of our upcoming 2026 centennial celebration, and our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are also available through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.